for the few more that are on Miami time. We'll let them file in, but we want to respect your time. And so we have plans to keep our time here right under an hour. So we will do our best to do that. But again, thank you so much for joining us tonight for navigating COVID on the autism spectrum, whether you're dealing with your child, your own personal family, or as I mentioned, if you just want to equip yourselves to better serve and understand other families who may be dealing with this challenging time with a child who may also have additional special needs. So it's always amazing to equip ourselves to serve others. And so we're really excited for tonight and for the panel that we have with us. My name is Cierra Bragan, and I'm the owner and founder of Miami Mom Collective. We are Miami's premier parenting resource, and we love equipping families with resources that will serve them to serve others. And so when Jackson Health reached out to us and UHealth Jackson Children's Care reached out to us to join this series way back when it was summer to school, as we were making the transition through the summers we prepared for school, and now here we are. It was a no-brainer for us to jump in because we just love the work that they're doing, the resources that they offer. And so to be able to bring these resources to you is a real joy and a privilege. So I'm super excited to introduce tonight's panel. I do want to call a couple things to mind. You may or may not know, but the pediatric emergency rooms at Holtz Children's Hospital, as well as Jackson North, are open 24/7. So I just want to let you know, heaven forbid any of us need an ER, but if you do, just a reminder that those are open to you 24/7. They're all staffed with board certified pediatric emergency specialists, as well as you get access to subspecialists at the Children's Hospital. So they're drawing from the University of Miami system as well as Jackson Health. So there's an array of specialists. And then also there's a kids only emergency room at Holtz Children. So if you ever have an issue with your kid and you're thinking, I don't know if I want to take them where everybody is, you can take them to Holtz and there'll be only children there, which is great. And all of the doctors and nurses are certified in pediatric advanced life support. So amazing resources there at Jackson and Holtz Children. So just thank you again to them for hosting this series. If you have joined us before, I saw in the comments, some of you have, you know how encouraging this series has been. So let's dive right in. I want to take a minute and introduce our panel. First up, Dr. Michael Alessandri. He is the Executive Director of the University of Miami, Nova Southeastern University, the Center for Autism and Related Disabilities. So if you've seen NSU CARD, I'm sure many of you are familiar with that. So this is Dr. Michael Alessandri. He's the Executive Director there. So thank you so much for joining us tonight.
Thank you. Happy to be here.
Yes.
Proud to be here.
Glad. We're so glad. And in addition, we also have Silvia Gil, who is the manager for the Daniel Jordan Fiddle Foundation Transition and Adult Programs at the University of Miami, NSU CARD. So NSU CARD, I'm going to go with that. How about that?
Perfect.
You can just say CARD.
CARD. Okay. From here on out, it's CARD. It's a mouthful.
It's a lot of letters.
We are so thankful to have you. She has her bachelor's and master's degree in special education. So I know she's got a lot of great wisdom to share with us tonight. And then finally, but not least, Dr. E. Robert Schwartz. He's actually been with us before. So if you've joined us in the past for a previous webinar, he was with us. But he is the professor and chair for the Department of Family Medicine and Community Health at the University of Miami Miller School of Medicine. So in addition to the amazing things that he has done in his studies, he's just done incredible things in the community. I wish I could tell you all about it, but I will tell you that in 2003, he received the Healthcare Heroes Award from the Greater Miami Chamber of Commerce. The Chamber of Commerce recognized his leadership in establishing a health center in Overtown. So that health center, I believe if I'm not mistaken, is still up in full effect, and you still do a lot there. Is that correct?
Absolutely.
Oh,
we see close to 30,000 patient visits a year.
Amazing. 30,000 a year.
Mm-hmm.
So, Dr. Schwartz, I just remember from last time, like you have a lot of great insight to share, but it's an encouraging thing to know that you're giving back to our community as well. So thank you all for joining us tonight.
Thank you.
Without further ado, let's dive in because we have lots of great questions. Many of you have submitted questions, so let's jump right in. I want to start, Dr. Alessandri, I'm going to start with you. Tell us how CARD and UHealth Jackson are building inclusivity for ASD within the community.
Sure, that's a great place to start. So CARD, just to give a little context, is the statewide agency whose mission it is to serve all families in Florida who have a child with autism or related disabilities or related disability. And there's 7 centers around the state, all regionalized. So anywhere in the state of Florida, you can get access to free services from a CARD center. What our CARD center is doing is partnering, in addition to serving people with autism, we're also partnering with local stakeholders like museums and performing arts centers and dental practices and hospitals. And so Jackson approached us because they heard of our Autism Friendly initiative, and they were interested in working with us to create autism-friendly urgent care facilities in their 5 urgent care centers throughout South Florida. And we did that. So Cece, who's Silvia Gil, who's on the webinar with us tonight, we'll talk more later, but we partnered with all the great folks at Jackson. We did training for all 5 urgent care centers. We created what's called a social narrative, which is a document online that tells the story of what the child will experience when they go to an urgent care center. And we also created autism-friendly or sensory-friendly exam rooms in each of the urgent care facilities, along with sensory toys and other sensory materials, just to make the experience more, user-friendly, more satisfying for the family, more enjoyable, as enjoyable as an urgent care visit can be for a person on the autism spectrum. Because what we need to do with people with autism is prepare them. And if you can prepare them ahead of time and then create an environment that is consistent with the way that they enjoy learning and enjoy life experiences, then they're going to have a more positive experience. So we've launched. We're seeing kids in all of these 5 centers, and it's been a really positive. The community response has been really positive. We've actually recently gotten an inquiry from another large local hospital system wanting to do the same thing, wanting to follow in Jackson's footsteps and do the same thing for their stakeholders and constituents.
Wow, that's amazing. Bravo to Jackson for paving the way in that, and then also for you guys to partner with them to do
Jackson's the first in the state, possibly the first in the nation, to have an autism-friendly urgent care facility. So it's really exciting.
That is really cool. Wow, thank you. That's awesome. Okay, Silvia, tell us, how are UM and Jackson working together to build capacity through partnerships?
So kind of like what Michael was saying is we have our Autism Friendly initiative, and through that and that partnership, which is so crucial, we really provide that training, the support, and really understanding the unique needs of Jackson Healthcare. So, we did a lot of conversations, observations, and worked with the staff to say, okay, these are the specific things that they need to be trained on, in terms of really from customer service, how to treat a patient, and then really incorporating even that sensory-friendly room and the visual support. So that social narrative, really preparing them for what to expect, as well as visual supports to help communicate with the patient as well.
That's amazing. Wow. I love that. I don't know why I didn't know this. So this is just good information to be able to share with these families, because I have to imagine just the thought of like, man, we've got to go, try to have one of these appointments and thinking about preparing your child, but knowing that you have already done the forethought to have that space prepared for them is huge for families. It's huge.
And if I may, I think what everyone listening should understand and hopefully appreciate is how difficult every little life experience can be for a family who's raising a child with autism. So imagine the level of complexity of an urgent care visit. So everything that we do in the community is to build a more inclusive, a more accepting, a more welcoming place so that our families feel that they'll have the support wherever they go, knowing that it's going to be difficult, because otherwise they become isolated and really feel disconnected from the broader society. So we're just trying to build a bigger net, if you will, a support network that includes everybody beyond just the experts, but the whole community.
That's so great. Can you tell us the assistance that CARD offers for families with children on the autism spectrum? Can you kind of elaborate on that?
Yeah, for sure. I'll do it it's pretty much a la carte, everything that you need whenever you need it. It's one of those, I always tell everyone it's the miracle program of Florida that nobody knows about. But essentially every single person with autism and their family and their teachers and their doctors and their neighbors and their law enforcement officers and businesses can come to CARD to get the support that they need to be more, like I said, be more ready to deal with people with autism in the community. So we educate parents, we educate teachers, we educate broader segments of the community, but we also provide case management from the time the child is diagnosed all the way throughout their entire lifespan. So it's a lifespan service, any age, any functioning level, at any point in the child's life. Our 4 pillars of service are taking care of the child and family, so family support, training of anybody who wants any kind of training related to autism, will provide it. Programmatic assistance to schools and to residential centers and to employment and to businesses and to, again, any other aspect of life that wants to experience a higher quality of programmatic delivery. And then public education and awareness, like what we're doing tonight, just talking about autism, talking about what the community needs and what the community's doing, and hopefully building those bridges to a better future for our families.
Oh, that's so great. So if families are listening in, maybe if their child is at a school or a daycare or a center or anything, I mean, this is information that families can provide to the daycare. Say, hey, do you know about this resource that could help, you know, their child's teacher or the staff really be more equipped to serve their family, correct? Like, is that right?
Yeah, I'll let Cece take that because she
does. So it's not just the families, you know, and we really want to stress it's the entire community, because our goal is to really build capacity and have them be able to access. So accessing their schools, you know, the community from urgent cares. So really what we really want to show is it's not just servicing the family, it's their entire community as well.
Great. That is awesome. There's actually a mom in the comment who said, huge fan of CARD, life-changing for our family. So
we love to hear that.
It's got to be so rewarding to know the work that you're doing is impacting families in such a way. So can you speak a little bit more specifically, Sylvia, to like programs that CARD offers to educate the public?
Of course. So we do offer, and as Michael was saying, we do offer these public educations where we talk about CARD services, but also trainings as well. So we all know as parents, we need that wealth of information. So we'll talk about from development to behavior and social skills, life skills. We offer that throughout the entire year. And what's great now with this kind of platform is we offer it virtually. If you're not able to attend, we have a YouTube page full of different types of trainings that parents can access. And as well as agencies. So if, let's say, an agency wants a specific training, kind of what you were saying, like a daycare center, you know, they don't really know what skills and how to incorporate that early education, they can always request our services and we can go out there and provide specific training for that program.
That's amazing.
I think just if I can add a few other things. Yeah, I mean, the one big thing I want to say is it's all free. This is funded by, you know, we're a statutory program. We're in the governor's budget every year, and we're funded through the Department of Education. And all of the services that families and the community receive are at no direct cost to them. And we have programming for. We teach parents of young children how to interact, how to develop social communication skills in their children. So that early intervention programming we do. We also have programming for, we have summer camps, literacy-based summer camps. We have teen social groups that operate on a monthly basis. We have adult social groups that operate on a monthly basis. CC oversees job training programs for adults who are seeking employment, and beyond and beyond and beyond. There's something for everyone. It's really it's special. I hope people who don't know about us will discover us tonight.
That's incredible.
And it
reflects
reflects
even too a little bit, but I'm like, there's so much more that I didn't know. Incredible. Tell us.
And we're currently serving over 13,000 families just here in Dade, Broward, and Monroe. So, and there's a lot more out there that haven't even found us yet. Surprising.
That is awesome. Where can families, and we're going to keep chatting, but just right now, tell us, where can families go if they want to learn more? Like, is the website the best place?
Yeah, I would say if you go to umcard.org, you're really able to find all of our services, a little brief, kind of what Michael was saying in terms of all the programming that we offer, but also what's more important is registering with CARD. Because when you register with CARD, you get a case manager, because everyone's needs are completely different. And so, and where you are in your life. And so what we can do is assign you a case manager, and that can definitely give you all the information you need to access the programming.
That's awesome. Sylvia, can you speak a little bit more about the lifespan care coordination services that you guys offer? I know that you do that transition, those all, you know, he mentioned some of those programs. Tell me more.
Yeah. So the beauty of CARD is once you're registered for life. So we have constituents that register with us at 2 years old, and you know, there's unique challenges with every phase in life. And they'll register with 2 and maybe come back to us at 4, at 8. And no matter where you are in your journey, you know, your case manager can kind of direct you to what you need at that moment in your life.
That's amazing. Awesome. Circling back a little bit, and Dr. Alessandri, maybe you can speak to this, but speaking about those centers, are there any ASD-friendly labs inside of these facilities? One mom mentions that lab work is a really huge obstacle and difficult to navigate.
Yeah, CC may have a better response. I don't know if the urgent care facilities, I'm assuming there's lab work that happens there. I don't know. I can't speak to that directly.
Okay.
But there are, for adults, there's a program at FIU called FIU Embrace, where I do believe that they can offer that laboratory work that's necessary. And we also have some mobile phlebotomists that will travel and work with, that have experience with individuals with autism. They will travel to the homes and do lab work, which makes it a little bit easier, well, a lot easier for families who struggle to get their kids to the place where the labs have to be done and then through the lab work itself. But do you know, Cece?
I believe that urgent care sites do, I don't know if Dr. Schwartz, you know, but they do have all the lab work as well. And they can
Sure.
utilize the sensory friendly room and all the tools, especially that social narrative, as well as your sensory kits that are there. They can utilize that while they're doing the blood work.
Sure. Let me jump in at this point.
Yes.
And address the fact that I'm the medical director of the urgent care program. There are 5 centers around the county, and all you need to do is Google UHealth Jackson Urgent Care, and you'll find the addresses and phone numbers. It's important to know that you don't need an appointment to come and be seen. I think the other important issue is just a little description of the fact that it's a very safe place. A lot of people nowadays are afraid to go to an emergency room or go to a doctor's office or even urgent care. And I can assure you that we have all of the appropriate personal protective equipment. The waiting room is not full of people. You're asked to actually wait in your car and then you're called in. So we take every precaution to keep everyone safe within the urgent care centers themselves. They're all staffed with family doctors who are graduates, many of them of our program, actually at University of Miami-Jackson, and they're all board certified. And for people who don't realize, family doctors actually in their training take care of children, women. They're skilled at gynecological and obstetrics, adult care, behavioral medicine. And one of the interesting things that we've done is to train everybody on the autism spectrum and how to deal with not only children, but families. So everybody's taken our internal course so that everybody's prepared, along with the fact that we've made the special arrangements for children within each one of the centers.
That's amazing. Wonderful. So I guess parents of children, who may be on the ASD like spectrum, what specifically could they expect when they come to one of these 5 facilities?
So of course, it's the typical way in which children and adults are seen. The history is taken. We have a Cerner electronic medical record system. So once you come in to the healthcare system, it can be shared among all of the centers, the hospital, and any future healthcare seeking within the Jackson Health System. If a physical exam is, of course, done, and if labs are required, they're able to draw labs at the site. There is radiology. You can have on-site radiology if a child is injured in extremity or there's a question of a fracture. The children can be seen at that moment. They don't have to go somewhere else. And of course, they make an assessment and then an appropriate plan on how to treat them. Either it's antibiotics, or if they have a viral syndrome, or being tested for COVID. All of that can happen at the site.
That's great. Now, correct me if I'm wrong, this is all of the urgent care centers are ASD friendly, right? The 5 locations?
That's
All
correct.
5 locations. And really, one of the great tools is utilizing a social narrative. So as we know, individuals on the spectrum really thrive on when they know what to expect. And so we really want to encourage our, anyone that's listening, is to really look and find the social narrative, and it kind of walks you through what they can expect. And we want to go over this, not when the child or the adult is sick and needs treatment, but really looking at it when they're well and they're healthy. That way, when it does come time to having to be treated at urgent care, they already have some familiar, feelings. They know what the building or what the room looks like, and they know what to expect in the process.
Yeah, it's great. Oh, wow. We've learned so much already in the first just a little bit. It's amazing, what Jackson Health has done in partnership with CARD to make this easy for families who it's just challenging. Every little activity can be so challenging, but something that is already high stress for anyone, that you guys are just doing amazing things to make that a service to families. So I want to transition a little bit. We're talking about COVID, navigating all that. Back to school now is coming. Our next webinar, we're going to dive a little bit more into back to school and anxiety and that kind of thing, but specifically to autism. Can you speak to how parents can maximize virtual learning for children who, may not be able to sitting in front of a computer screen for long periods of time?
It's a really good question, and there's no easy answer to how to really optimize the virtual experience. What I will tell you is what I tell all of our families, that our kids need they need enriched learning for sure, and they need access to the content that they're supposed to be learning for sure. And virtual is the best option we have right now. And so we have to just accept that this is our reality until we can physically get back to the hands-on teaching that kids with autism need so desperately. They need a teacher, they need a paraprofessional, they need a speech therapist, and they need them all to be in the same space with them to really have an optimal outcome. The virtual experience is okay for the time being, but it's quite limiting. And there is real regression. There is real frustration. Parents are being asked to be therapists, to be teachers, to be administrators, and it's really too much to ask of anyone. What I will tell parents is that, no child of any age should be in front of a screen for a whole school day. So you really have to work very hard to advocate for what's best from a child development perspective for your child. And I've encouraged parents to meet with their teachers, talk to their school administrators, and make it clear that my child can do 5-minute blocks, 10-minute blocks, 15-minute blocks, and then needs work off the computer. Maybe there can be lessons that are sent home, worksheets that are sent home, other types of experiences that they could maybe access even through the computer, right? So maybe there's a recording they can watch later, or there's a lesson that they can watch on the weekend. They have to mix it up. No child with autism should be sitting in front of a computer for a whole school day. I actually feel that no child should be sitting in front of a computer for a whole school day. So there is a little bit of a disconnect between what is best in terms of child development and what I think schools feel obligated to provide in terms of the length of the school day and the amount of content. And that tension is really challenging for parents. What I would expect parents to do is to do what they would do in a real life situation, create a visual schedule for the child for the day, include opportunities for breaks away from the computer throughout the day, and build in a lot of tangible reinforcement for the child for sustained engagement, sustained attention, and effort to get through the kinds of tasks that they're trying to get through. So use a lot of the best practices we use in teaching children with autism in the context of virtual learning, and you're going to get more out of it.
Michael, that goes for adults too.
Yes, exactly. and on my 12th hour of Zoom right now, so I'm not practicing what I'm preaching.
Oh, wow. Yeah. And you hit the nail on the head too, talking about parents who, everyone is at capacity right now, but I think of families who have children with autism, and like you said, they're not having to just be teacher, they're also therapists and all these additional responsibilities. So just a word to you families out there who may be listening in. We all know that we're all doing the best that we can. And so we just salute you as well, just in this season. It's challenging.
Also, I will tell you that, it's not uncommon for there to be more than one child with autism in a family because this is fundamentally a genetic disorder. And we have many families who are juggling, trying to manage multiple children with disabilities with autism in terms of their learning, their virtual learning at the same time. So each of them requires independent adult support from separate caregivers, and that's nearly impossible for any family to manage. If you have more than one child, it's really it's an uphill battle that is really just fraught with frustration, unfortunately. So we try to support. We've had hundreds of these kinds of webinars where we talk about virtual learning. We talk about supporting families through it. We have lots of support groups where we commiserate about how challenging it is. And I think, at the end of the day, we're just trying to let people know that there is support out there, even if we can't fix the problem right now, because it is what it is. We're dealing with COVID. Schools aren't open for the most part. We have to make the best of it, and we have to just nurture people through it.
That's right. That's
Sierra,
right.
let me add the comment that all of our family physicians who are working in the urgent care centers have behavioral health training. So I think that's important for people to understand that just because they're a physician seeing patients potentially in an acute situation, they all have very good psychosocial skills as well.
That's great. Oh, that's great. Oh, wonderful. Yeah. So you know you're getting the best resource when you're going to those locations. That's so great. Talk to us about, some schools are starting to go back in person, and we know that's on the horizon for many people as well. But how can we train children in wearing PPE and masks, and with that on the horizon, and also what are ways that we, other ways we could prepare them for going to school? Because like you said, it's so important to have that narrative before. So how would you advise a family?
So I think first is understanding that PPE is a process. No child is going to be able to go from, their everyday to, okay, now we have to wear a mask for 8 hours a day. And so I think it's kind of, how do we start introducing that? And that could simply just start as holding the mask, feeling it. What does it feel like? Maybe putting it on your ear for a short time, and then the other ear, and then expanding that. So maybe wearing it for 5 minutes, 10 minutes. And as the child is engaging with the mask, providing a lot of reinforcement. So, great job wearing that mask, maybe a tangible, something that, if you can wear it for 5 minutes, then we get to do your favorite activity. Or we use a lot of that first and then. So first we wear a mask, first, maybe putting a timer. We're going to try it for 10 minutes, and then you get to do a fun activity. So just knowing that it's a process. And another thing that I've done personally with my kids is getting masks that they enjoy. So I get masks with their favorite characters, just to kind of have them have that engagement. But really for families, it's knowing it's a process with something we have to work on to keep our kids safe, and don't get discouraged. So just kind of keep reintroducing it, providing a lot of that positive feedback, and seeing over time that they can, withstand for longer periods of time.
It's a skill like every other skill we teach.
Mm-hmm.
So, and if we can get parents to conceptualize it that way, parents of children with autism are experts at understanding how to break down skills and teach using reinforcement, because that's what they're taught from the get-go. So if you can just conceptualize this as another task that needs to be mastered, and then fuse it into the virtual learning curriculum, so maybe there's a minute in the 15-minute lesson in the morning where they're doing a playful activity where the teacher puts the mask on and the child can wear the mask for a moment, and then they can take it off and build toward longer opportunities to wear the mask. But it's desensitization through exposure and play and lots of reinforcement. And we're seeing great progress with most of our kids in terms of mask wearing. And we've developed some mask wearing protocols and materials for families to help them. And kids can learn anything with the right instructional practices.
That's right. That's
Check
good.
out Sesame Street has videos. There's also videos that show, and I know Sesame Street actually just introduced, and we've been watching it with our kids, and that's been helpful.
I love it. I love it. I know that scaffolding process that you're talking about. So encourage this mama. One mom asked a question: how does the mask learning work with a 3-year-old who's nonverbal? Very challenging. Any tips for her?
I mean, yeah, I think it's so she's probably doing either speech therapy or applied behavior analysis with the child, or occupational therapy. I would encourage her, because I think it is difficult for a parent in that context to teach some of these more challenging skills, to find a partner on the therapy team that can work with her on doing some of this graded exposure, this little by little, moment by moment, expanding the time, and building also that motivational system that would reward the child for at least attempting. Like Cece said, we start with hanging it on the ear. Usually in the beginning, we would just have the child hold the mask, and then maybe hold the mask up to their face, and then put it on the ear, and then eventually wear it. And we'd be happy to consult with any family on helping them with a protocol to expose their child to some of these teaching strategies. It's probably more than we can get into tonight, but we do have some materials like infographics that we've developed. And I think we have some videos that we're working on that we'll be able to share with families as well, that will show them the protocols in practice so that they don't have to imagine what those might look like. But like any skill, just like you're teaching a child to identify an object or say a word, think of that, just add that to the list of things that you're trying to teach them with the same strategies for learning.
So Sylvia, I have a question since this came up with a nonverbal child. Has anybody tried putting odors or smells like chocolate or candy smell inside the mask, especially for nonverbal children that they might actually like putting the mask on so they could smell something sweet or something that they enjoy? Is that something that's been tried?
I've had families use essential oils that are natural. So whether the child likes lavender, eucalyptus, so there's all sorts of smells, and maybe having the child smell different types and see what they're attracted to. But that would be something that has worked with some of our families. But again, I think it's all about the process, you know, as we've been kind of sharing, and not feeling that discouragement. Oh, well, my child can't do it. You'd be surprised at some of the skills that we can learn when we're persistent, and really finding that right motivation. So what motivates that child to wear the mask as well?
That's good. Dr. Schwartz, you might be onto something. I think I might be.
Good question.
The chocolate mask.
That's what I need to do.
I know I would wear it.
That's right. Oh, well, we've got lots of questions are coming in, so I want to try to get to everything. Thank you to those of you who are asking questions. Let me take a few of these. So we'll pause from where we're headed, and then in a minute we're going to get into PP and other precautions with Dr. Schwartz specifically about those on the autism spectrum. But a couple questions we've received coming in. Any recommendations for learning, recommendations for routines, executive functioning skills?
You want to?
Either one of us can take it. I mean, I think it depends on the age of the person. So if we're talking about a child, there are going to be certain. I mean, executive functioning is super important in the context of autism. One of the things that we know, even from we do some neuroimaging research in our department, we know that cognitive inflexibility is a neurologically kind of based characteristic of people on the autism spectrum, and what that yields is executive functioning deficits. And so the ability to plan, to organize your thinking, to really get your processes in a meaningful order is really important for people with autism. And when they can't do it, it affects every aspect of their learning and their social interaction and their communication. So there are strategies that are useful. There are really nice curricula, nice websites, nice books that are available. The social thinking, if anyone ever wanted to go check out a really useful site, there's a site called Social Thinking by a very renowned speech therapist, Michelle Garcia Winner, that I encourage people to go look at. There's some excellent work there on executive functioning. We also work with executive functioning coaches, a couple of private businesses in our community that work directly with parents and caregivers and people on the spectrum as well. But we also do that kind of training on a regular basis. We will offer those trainings so that people can come and get the useful tips. But it's all about organizing. You know, we do everything visually in the autism world. So when you can present your schedule visually, when you can present work visually, when you can present tasks that a child or a person needs to conduct visually, and if you can put the effort in on the visual side of things on the front end, then the processing becomes a little bit easier on the back end. But again, you know, there's so much rich content in this area that it would be a webinar all of its own probably. But I would like to direct people to some of these other resources, or to follow up with us for specific clinical recommendations for the specific issue that they're having.
Awesome. Talk to us about ABA. A couple people have asked, how does a parent go about allowing their child to attend school with an ABA therapist? Another one asked, any recommendations on getting help with ABA?
So I'll start that. ABA is applied behavior analysis. It is one of the hallmark treatments for autism, one of the strongest evidence bases for positive outcomes in terms of autism treatment. So it is absolutely a recommended practice for not everybody, I wouldn't say. No, you can never say for everyone, but for most kids, particularly early learners on the spectrum. We have a database of ABA providers. We also know which insurances they take. So if people register with CARD, 1-800-9-AUTISM, they can register with CARD. We can assign them a case manager, and then we find out their insurance, and we can find providers that are a good fit for them. Like we do the dating, the matchmaking. We find the provider that we know is going to work best with this kind of case and this kind of family. But ABA is absolutely recommended. Miami-Dade, actually Florida public schools do allow ABA providers in the classrooms now. A law was passed a few years ago that mandated collaboration between public schools and private providers. And so now, as long as they're screened, level 2 screening, and approved by the principal, most of the schools will allow the ABA providers, what we call the RBTs, registered behavior technicians, in the classroom, because some families are getting 20 to 40 hours a week of ABA services. So it's useful to have that extra support in the classroom when appropriate.
Yeah.
It's not always recommended.
Amazing. And
clinically, it's not always
right,
recommended
right.
because sometimes the therapist standing next to the child, while helpful in terms of executing a treatment program, might not be helpful in terms of trying to build social interaction years, because there's an adult
Right.
kind of barrier.
That's great. And so you said 1-800-9-CARD to register.
1-800-9-AUTISM. And if you're in
Autism. Sorry.
extension 1 if you're in
Write that
Miami.
down.
Extension 1 if you're Miami.
Near Miami. Okay, great. And the services for CARD are the whole state of Florida, right? You guys don't go beyond in terms of like the Bahamas or any other areas, correct?
No, we're Florida funded, so we're only Florida. Fortunate, I mean, I will tell you this: if a family happens to be in Miami and calls the center and they are not from Florida, we will often take the time, our own time, to meet with them. We can't serve them, but we can certainly meet with them and give them our best guidance for the next steps.
That is great. Okay, one more question that we had. It's a little bit specific, so maybe I'm not sure how much you can speak to it, but someone said they've asked for their child's school day to be shortened because their child is really struggling with the 8-to-2 schedule, but they were told that it couldn't be shortened unless they did a hospital homebound program. Any advice or encouragement for that?
I mean, I think that's an advocacy issue that's very, very particular to this particular case. What I would say is the school has an ethical obligation and a legal obligation to insist, essentially, that the child fulfill their time in school and that they provide. A child with an ASD also has an IEP usually, and that's a legal and binding contract between the parent and the school. So the school has an obligation to try to meet the goals of that IEP, and they can't do that in a shortened day. So I understand the school's perspective, but I would work with the family and the school on finding an accommodation that allows not necessarily a shortened day, but maybe a reimagination of the day. And we'd be happy to meet with that family to talk through that and really help advocate for what's clinically best for that individual during COVID. But the school has no choice but to try to really insist that they fulfill their side of the bargain, which is provide a full school day for that child. Right. So this is where the tension lies in the middle of COVID. Like what's people are required to do and what's really best are two different things.
Often two different things. That's right. And you may or may not be able to speak to this, but this was a question that came in, like, how can they start applying for special needs services for the 2021-22 school year? Is that through MDPS? Are there services through CARD that they need to apply through?
I'm not sure what services. Nothing at CARD you have to apply for. You just show up and we assign you, and then you participate in anything that makes sense for you. In terms of other kinds of services, I don't. There's no application process for Miami-Dade. I mean, there are scholarship programs, voucher programs in the state of Florida, and in order to qualify for those, you have to be, at least for one of them, you have to be in public school during certain periods of time during the year in order to be eligible next year. So maybe that's the McKay scholarship. If they're talking about that, they definitely need to be enrolled during the first week in October, or I think it's October 5th that week, and then there's another week in February. But if they're not in those counts, then they're not eligible for the McKay until another year. So it's a little bit, in the weeds, and I don't want to go there right now, but that family can reach out. They can reach out to me and we will work with them on figuring that out as well.
Oh man, I just love how willing and open clearly your organization is to say, we just want to help you and support you. So clearly, families, if you're listening in and you have other questions or questions you're afraid to ask, call them, send them an email, get on the website. Okay, I want to transition now. Dr. Schwartz, we're going to talk about PPE and other precautions in terms of families who have children on the autism spectrum. So can you tell us how COVID rules and precautions may differ for individuals on the autism spectrum?
Well, to be honest, they don't actually differ. I mean, this has been out in the press and the public for quite some time now, and the really simple issues that the COVID virus is a respiratory virus, and so it's actually transmitted through the air. And so the most important thing is obviously wearing a mask, washing hands, and the social distancing. Those are absolutely real issues. Now, of course, with small children, that's obviously not an easy thing to deal with. But certainly parents have to clearly, start that process at home. It's not recommended that children under 2 wear a mask at this particular moment in time. So the older children are certainly encouraged. I've had little children myself at one point in my life, and I can really remember quite clearly that trying to get them to do anything for any length of time, like wearing a mask or washing their hands or social distancing, sometimes it's not a reality. So one can only try and do their best. What I can say, though, that is if families need to come into urgent care, the staff are wearing protective equipment, masks, face shields, gloves, etc. And within the environment of healthcare seeking behavior, the environment within a urgent care center or even in the emergency room, the staff are certainly well educated about protective functioning within that environment. So it's really just, I think it's an education process for families is to help children, have hand wipes in every place, in the car, at home, in the bedroom, etc. It's important that if they're wearing cloth masks, to wash them on a daily basis. A lot of people I see are reusing their masks, and that's not a good thing because viral particles can stick to a face mask. So frequent washing. If they're using paper masks, hopefully they're not using N95s because there really is no indication at this point that N95s are appropriate. If they're using paper masks, I would suggest not using them for more than a day or two and then switching them out, throwing them away, and switching them out and using new masks.
That's good. That's good. Yes, wash those masks. It's easy with the cloth ones to shove it in the purse and pull it out. And then I think, man, I'm just shoving all those germs down in my purse.
The other problem too is that in many people, adults included, have a difficult time because the mask irritates or is itchy, and people then are taking their hands and touching the front of that, and then maybe touching something else or putting their finger in their mouth or touching their eye. And that's also another way of transmission of the virus. So it's also important to educate families about the proper use of masks and clearly the imperative to carry some type of hand sanitizer with you and clean your hands frequently and try obviously avoid manipulating the outside of the mask.
That's right. That's good. I know we spoke a little, you mentioned this just from the get-go, but the guidelines for children with ASD wearing masks, like you said, there's not much difference. So they need to be wearing those masks as best they can. Anything you would add? I know we spoke a little bit to it already, but like of ways to train children to wear them. Also just, we had one mom ask a question about how do we kind of, in social situations where maybe you go into a restaurant or a business and they're like, your kid's not wearing a mask, like how do you kind of talk to them about your child's situation with maybe not announcing the diagnosis or making a scene?
I think I'm going to punt that one to Michael.
Well, I mean, Cece maybe has some thoughts about this too. I mean, she works a lot directly with clients, and I'm happy to answer it if you want, but I think why don't you start, Cece, and we'll tag team.
I think the biggest thing for anyone that's watching is really working with your child to start wearing a mask. And I say this more out of the safety for them. So that's just something that we're going to start working on. But let's say you are going to go somewhere and you don't want, we're all always very self-conscious about those eyes and comments. And so maybe before your child enters the restaurant, talking to the manager, letting them know what the situation is, and really what's the safest way, maybe if we're going to a restaurant, is there a way we can go from the outside? Is there a way we can social distance as we walk through the restaurant to keep ourselves safe? So I always really want to stress safety. If we want to avoid having that kind of conversation, maybe you coming in first, having that conversation and setting up a plan for the child to come in.
Yeah, and I think the mom on this call was maybe saying, without necessarily having to disclose, but I actually, I've been here at CARD, this is my 25th year, and in the business of autism even longer than that. And I will say, I'm a full proponent of disclosure. I think it's really important for people to tell other people what their experience in life is. I think the only way we get other people to truly understand kids with autism, adults with autism, is if they know that they're interacting with a child with autism or an adult with autism. And I have found, at least in my walk of life, that when people have the information and are taught to understand, they're pretty accommodating for the part. It's when they don't know what they're dealing with that they often make judgments or make choices or decisions in their interaction with those folks that are not in the best interest of really anybody in that interaction. So I agree with Cece. I think a little information on the front end opens a whole lot of doors. I will also say that, I served on the mayor's task force for childcare and daycare center, summer camp over the summer. And, I know Mayor Jimenez and the commission were really open about the idea of some accommodations for kids on the spectrum, kids with disabilities, in terms of mask wearing. Of course, the public health issues really do have to take precedence here, and we have to train our kids as best we can. So we should try to do it as much as we can. But I do think a little information goes a long way in helping other people understand, and choose settings cleverly. Like, go to places where there's outdoor seating, go to places where there can be easy social distancing. Like, don't be obstinate about wanting to go to a certain place to make a point. Like, this is not the time to be making a point. I think this is the time to be trying to comply with the rules as best we can.
Yeah, I would second that, Michael, in the sense that it's really imperative not to go to crowded places. So if parents see that if they're want to go to a particular restaurant or a particular outing, and there's really lots and lots of people there, those are unfortunately the situations where unintended consequences occur, and people are at risk for exposure, because whether we like it or not, there are many people who are walking around community who are asymptomatic and not necessarily taking appropriate precautions, and that's where we're finding spikes in the COVID crisis.
Yeah. Yeah, Dr. Schwartz, thank you for adding that. I know the work that you do at the hospital, you see firsthand still how these cases are occurring. And so you can speak to that. Anything that you would add for families who, may be wanting to implement an outing, but will remain safe? You said avoiding places that are crowded, obviously. Any other tips or suggestions you would offer?
If you're directing that to me, I would just go back and reiterate the fact that carrying with you hand sanitizer is clearly an imperative, and there are different types. I think there's been a fair amount of warnings about making sure that you get qualified and appropriate hand sanitizers. There have been a lot of inappropriate products on the market that have kind of are not labeled properly, or they're not using alcohol or other types of things. It's also imperative with small children to make sure that they can't open bottle tops and potentially orally ingest some of the hand sanitizers. That would be a real problem. And then, the other issue too is that when you come home from any of these outings, take their clothes off and throw them directly into the washing machine. They've made us do that at the hospital, and in our ambulatory area. We used to wear white jackets and ties and things like that, and now all the physicians and staff are wearing scrubs. And the goal is, when you get home after taking care of patients, you take it off and throw it directly into the washing machine. And so I think that that's actually a good recommendation for families as well, that if you've been on outings and not being able to socially distance sufficiently well, come home, take your clothes off and stick them in the washing machine.
That's good. That's good. I'm glad you made the mention too of hand sanitizer. I'll put a little plug for one of our previous webinars we did about poison control. And our representative from the poison control actually said there's been a pretty good spike in the calls during the COVID season. And I thought, oh my goodness, why? And she mentioned that hand sanitizer ingestion was a real thing. And I thought I'd never even thought of that. But even the pumps, kids pumping, the foam kind and ingesting. So I'm glad you spoke to that. That's something for us to stay aware of.
Can I just add one quick thing? Like, I want to tell parents to take the easy road right now when it comes to outings. Plan ahead, choose familiar settings, and choose settings that are highly preferable for the child, where people know you already. This is not a time for new experiences.
Okay, yes. Okay, we're just under like 10 minutes. There's so many great questions. We could go for a while, but we do want to respect everyone's time. So I'm going to start kind of blitzing through. I want to talk about family coping. How can we discuss topics such as the pandemic, virtual schooling, social distancing with our children who may have ASD?
Yeah, I think it's really crucial to have these discussions. And no matter where their cognitive abilities are, our kids really feel these changes, whether they can verbally express them or not. And kind of what Mike was saying is it's really important to utilize visuals. So using a social narrative to kind of describe the changes. And another big thing too is when I speak to my kids about the pandemic and all that's going on, we really try to focus not on this very scary, COVID-19, but what can we do to keep ourselves safe? Kids like to feel proactive, and we say, we're going to wash those germs, we're going to wear our masks to keep ourselves safe. So it's allowing for us to have the conversation without, terrifying our children, although we may feel very scared. But really, how do I make them proactive? And I also give a lot of opportunities for them to ask questions. So, why am I not going to school? Why have things changed? So being honest with our kids of what the situation is without, it being a scary situation for them.
That's good. I love that. Staying proactive, not reactive. Talk to us about what can parents do to keep their children engaged if they're stuck inside so long? And then another kind of like addition to that piece, a mom asked, they live in an apartment, the playground's closed, the pool is closed. What are some ways that they can have their child doing physical activities, but safely? Because the child tends to run off when they get excited, they see a playground, and then they can't go,
So this is my life. I have a 3 and a 7-year-old.
I was going to say, you take this one. You have the babies at home.
And I work full time, right? So there's that added stress of, I have my own schedule. The best thing for any parent to do is start implementing a visual schedule. That visual schedule really allows the child to know what to expect, what's going to happen, and also keeps them engaged. And so we have blocks, we have Play-Doh, we have sensory boxes, and Pinterest is a great way to try to come up with some new activities to keep your children engaged while you try to work and do a million other things. So I think it's about having that schedule, having a routine at home, because we know our children thrive when there is that structure. It also makes our lives a little bit easier, and really just introducing new types of activities. So printing out different arts and crafts. I have, bins with sensory, with water beads and sand. I live in a townhouse with no backyard, and so I have that struggle. We invested in an indoor trampoline because my 3-year-old was using my furniture as a playground. So, we have to think a little bit outside the box because it's not our kids' faults, right? We've taken away school, we've taken away everything of their norm. And so we have to really recreate it. And we recreate it by just introducing new activities, being a little creative within our own space. So yes, maybe the trampoline might help. It gets that energy out.
That's great. If you need a trampoline to cope with the pandemic, whoever gets that license has it tonight.
I start using it too, right?
Dr. Alessandri, tell us, how can we maintain meaningful family interactions when routines are just nuts right now?
Well, I think in some ways, the whole virtual world has allowed us to establish even stronger bonds with people that maybe we didn't see so routinely. So, I'm in much closer contact with my clients and family now than ever before, because we have this, virtual connection that we were underutilizing previously. So I think, again, it's about those routines, like establishing routines where you're checking in with your grandparents, you're maybe doing, the drive-by, wave and visit. You want to see people physically as well as virtually. So there are opportunities to do that, and safely with social distancing. And I think parents should really be thinking of the safe ways that they can, expose their children to the loved ones that they have, whether it's, by visiting on the front lawn and waving, or driving by, or being in the driveway, whatever works for the family. But, there are a lot of opportunities virtually, I think, to connect with friends that they haven't seen since school let out, to connect with their therapists or their teachers, beyond the classroom virtual instruction. I mean, I think we're doing way too much virtual in general, but there are ways to utilize the virtual platform in a positive way, in a pro-social way, that I think probably parents are forgetting about, because they're so fed up with the virtual by the end of the day that they don't want to open the computer again. But like, we offer a lot of fun activities for families. To piggyback on what Cece was saying, we do like social events or play activities that we do virtually with families to get out of the routine of academic or school-based work, so that it's just another way of using virtual, but for something more fun in the week. So parents could just log on and join us for a fun activity with Sarah that we have, let's say, on Wednesdays, or summer. We used to do morning circle the summertime for kids to just be with other kids. So, but with family, I think, it's just about maintaining doing that regular check-in, having a regular scheduled check-in with all family members, and embracing that this is complicated for everyone at every level.
That's great.
It's really hard. Like, we have to just honor that it's hard for everybody.
That's right. Okay, we know Silvia has the trampoline in her back pocket. I want to know, what coping skills would you give parents maybe to keep in their back pockets so they can maintain a positive outlook in this challenging time?
Yeah, I think recognizing that it's hard, recognizing that there are good days and there are bad days. I think it's about really incorporating some healthy coping skills. For me, it's exercise. I got my Peloton bike. I use that and it relieves some of that stress. Or sometimes it's taking a 5-minute shower and I give my kid, my husband, hey, you're in charge, and I need to just decompress a little bit, because when we're not okay, our kids are not okay. So I think it's really, first and foremost, finding coping skills that work for us. And as hard as it is, especially having kids at home and you never have a moment, but really just carving out, whether it's 15 minutes a day for yourself to do something for you, so you can have more of that positive outlook.
That's good. That's great. We have 2 more questions that we received from our audience. I want to make sure we get to those before we wrap our time up. We did good. We stayed almost under an hour. So way to go, team. One mom is asking, and it seems like an advocacy question, but how do you get the teachers to understand that her son is high functioning ASD, but he still needs some extra time and direction? He's got a 504, but it just doesn't seem that he's getting, the time and direction that he needs.
That is an advocacy question. And I think we can enhance the 504, or it might be an opportunity to think about an IEP instead of a 504 plan. So it really depends on how substantial the disability is in terms of his ability to function in school. The 504 plan may not be enough to give him all the accommodations that he needs and all the supports that he needs. So it really is an advocacy question. But I do think, and Cece will also concur, I think, the high functioning, the very high functioning individuals on the spectrum often have what we often refer to as hidden disabilities. They look, they're functioning academically, they have good language, they're able to use their language for, at least meaningful, functional social interactions, and they can pass. They can pass in many instances, but they suffer. They have anxiety, they have depression, they often feel isolated. It's not easy for them to make and maintain friendships. And academically, they might have some strengths and they might have some weaknesses. There is a lot of scatter, even in the highest functioning individuals. So teachers may not necessarily understand how their learning deficits are really impacting them emotionally, because they may be passing, but they may be relatively failing compared to how they're doing in other areas, and that causes the psychological distress. So we'd be, again, it's a repetitive statement, but we'd be happy to talk to this parent and assign them a case manager and work with them on the advocacy piece, because there is an advocacy piece there.
Great. And part of our services too is, as a teacher, I understand, and as a general, especially if they are, high functioning and they're in that general education setting, teachers may not have the training and understanding of how to work with our high functioning population. So one of our services, and again, contacting CARD, getting a case manager, is us being able to go into the classroom when it's safe, observing and working with the teacher collaboratively to help expand what are some good, different accommodations that we can incorporate, what are visual schedules, anything that child specifically needs, and really helping the teacher better understand the specific needs of that child and how to incorporate that in the classroom.
That's good. That's good. One more question that we received from one of our listeners. Would you recommend sending a child to physical school when they have trouble keeping their hands to themselves, they're sensory seeking, and typically like overly affectionate, especially with adults? Like, would you recommend sending them in a physical setting, or?
That Dr. Schwartz may want to chime in on that. I mean, I think for me, the ultimate criterion is how well prepared is the school in terms of safety protocols, and how are they implementing those safety protocols with fidelity? Because, you know, I think we expect children with disabilities to not be able to comply with all the protocols. So everyone around them has to be doing it that much better to keep the rest of the environment safe. But I'm happy to pass the baton now to Dr. Schwartz about that question. I mean, I'm a big proponent of kids being in school, but our safety measures that we have to be sure are in place. They're not going to be foolproof. They never will be, but we want to have some assurances that what's been planned is really going to be what's executed.
Yeah, I think the environment that that child is being put in is really the critical issue. It can be very distracting, obviously, to the class and to the teacher, and can be very difficult to deal with. So it depends on class size, whether that teacher is prepared to deal with a child like that. I think if there are really strong issues of attachment and hygiene issues, then to some degree it is safer for that child to be at home. Unfortunately, you know, we have no idea how long this pandemic is going to last, and certainly well into 2021. So I think that, you know, one has to be creative in these situations, and it also depends on whether the child has some type of medication issues, and that may be a challenge. I want to take, I know we're a little bit over time, but I want to go back to what Silvia was talking about before about parents. And because I've seen so much anxiety and mild depression in adults. And I think in this particular issue where there are lots of stresses at home, I want to reiterate, taking time to exercise, taking time perhaps to meditate. There are a lot of programs in mind-body relaxation. You have to make conscious effort to help de-stress yourself. Perhaps not watch the news as much as many people do. I think that's important. There's a lot of media stress going on in the community. And so you're in a family situation which is already highly stressed. And it's clearly very important to take care of yourself, both partners in the family taking care of children, because as Silvia pointed out, that stress is transmitted to children and then makes the situation all that much worse.
Mm-hmm. You heard it here, folks. Doctor's orders that we need to do what we can to de-stress. No, that's a good word to hear. Wow, this has been an amazing panel. And I have to say, I commend all of our listeners as well for joining in tonight. I know some of you personally, and I know that that those mamas I know who are watching tonight are their child's biggest advocate. And I have to assume that others who have joined us tonight are just your child's #1 fan. And so the fact that you're taking this opportunity to glean and gain from these resources is huge. Of course, you know, be sure to check out CARD if you haven't already. Also, an amazing thing to know that Jackson Urgent Care Centers, all 5 of their facilities have accommodations for your families and for your children. So maybe you might run into Dr. Schwartz at one if you ever have to go, as he's the medical director of all of those, or he could be serving in Overtown if you see him there. But we are just so thankful that you all decided to join us tonight. If you'll look and see these resources here, you'll notice the umcard.org, also jacksonurgentcare.com, and to watch this video or maybe share it with a friend. Maybe you have a friend who couldn't attend tonight. All of our webinar videos are right there at jacksonevents.org. So this video actually will be up in the next week or so stay tuned for that. But go back, watch some previous ones that we've done. As I mentioned, you'll see the one with Dr. Schwartz we've done in the past. Very, very helpful. But just thank you for joining us. We appreciate it so much. And I do want to go ahead and tell you, please, please, please mark your calendars, because we continue to do these. And in 3 weeks, October 15th, we will do this again. And the topic is COVID anxiety and back to school. So we know schools, we touched on it tonight, but schools are starting to open, and all the anxiety that we're all dealing with as families just in this season, as back to school in person is happening in this new normal. we're going to navigate it together. So we'll have some experts with us, as well as the Children's Trust will be with us to offer tips to help our children face this, become more resilient, mature, how to navigate, how do we raise resilient children in this season of life. There are so many amazing resources. So thank you again to our panel. Thank you all for joining us. And thank you to Jackson Children's Health. We're so thankful for these amazing resources. I hope you all enjoyed it. And just thank you again for joining us tonight. And we hope to see you again.